Thank you, everybody. And obviously, a little bit different format tonight, so I want to thank the administration for making this happen and allowing us to continue our board meetings in person for those who feel comfortable to do so, but also providing an alternative for those, for whatever the reason may be, to continue to have access to these important meetings that we're holding. With that, my comments this evening, again, related to COVID, as we were discussing from our last meeting. I want to thank the staff of the school district for all the work that they're doing, the administrators, and everyone else involved, the teachers, the paraprofessionals, every single staff person for continuing to give as much as they're giving in these challenging times to provide premier education for our students. I want to thank the administration for all their support and leadership throughout this process. And I want to thank the board members for continuing to volunteer, showing up at meetings, and continuing to do the work that you've been elected to do to help lead this amazing organization forward. My comments tonight, I wanted to have the board and those listening. I recorded a brief statement. I was on a call today with the White House Intergovernmental Affairs Office. They have conference calls with leaders from the state and local government. So in my paid job during the day, I had the privilege of being part of that call, one of 600 individuals from across the country today. And the Surgeon General, Vice Admiral Dr. Adams, spoke about many topics, I think reaffirming and reassuring me that the work that we're doing here is very much in line with what's happening not only at the state, with the State Department of Education and with the governor's office, but also what's happening nationally. And so if I may, I'm going to yield my time to our nation's doctor, and we're going to try to play this recording so you can hear the message directly from the United States Surgeon General about his advice on schools.
March and in April. And you know, it's interesting because we've learned so much since then. We all were collectively worried about mass gatherings as super spreader events, and we included schools under that rubric of mass gatherings. We've now had the ability to follow data from schools that were opened all across the country. And we consistently find that kids in schools actually have transmission rates that are no higher than the surrounding community where kids aren't going to schools. And in many cases, they actually have lower transmission rates than people who aren't in school. And if you think about it, it intuitively makes sense. When kids are in school, they're going to be wearing their masks. They're going to be following social distancing. When they're at home, they're going to be out playing with their family and friends. They're not going to be wearing their masks. They're going to be at Walmart with mom and dad. And we have found that schools actually are among the safest places for kids to be. So from a reactionary point of view, I want to caution all of the leaders out there from just reflexively shutting down schools as we see cases rise. Because what you don't want to do is take people out of a situation that the data suggests is safer for them to be in and put them in a situation that is less safe. Europe actually was able to bend their curve. They reached the plateau for their third wave in about 5 weeks. We're on 8 weeks and still going. But they reached the plateau with aggressive mitigation, masks, social distancing, limiting indoor dining and bars. But the important but is they kept schools open, K through 12 and beyond. And so what I want to remind you all of is that there are real health consequences beyond COVID, mental and physical health consequences from shutting down schools. But what the new data suggests is that there may actually be unintended negative COVID consequences from shutting down schools. So take mitigation seriously, but understand that mitigation doesn't have to mean, and based on the data, shouldn't always mean closing down your schools. So thanks for highlighting that, Doug. And if you all want more information, it's on the CDC website, and we can send out the studies that have come out recently in regards to why people should stay in schools and the experiences that different school systems have had when they've gone back to school. But again, lower rates in New York That was one big one that we saw. Lower rates all over the country in terms of kids testing positive when they went back to school than in the surrounding communities where kids weren't going to school.
So I think that sums it up, and I wanted to give that perspective as well. So with that, I would like to move on to our next agenda item.